To practice recommendations based on the findings and the sources chosen would be first, formulate a standard educational tool such as an information binder or pamphlets with various additional videos. This recommendation would fight and reduce the healthcare issue of the oncology knowledge deficit by increasing nurse and physician information, carrying over to patients' knowledge and accountability. In Chu et al., after the questionnaire was completed, patients stated that they wanted more information on the topics such as their diagnosis, tests, surgery, radiation, chemotherapy, clinical trials, sexual function, psychosocial support, and financial care. If there was a standardized tool to go through during patient teaching sessions, no information would be left out or avoided. As Chu et al. Goes more into depth, patient reported the lack of knowledge in non-critical information such as sexual health, support, relational, and financial care. If this tool has resources and written out handouts, patients can reinforce the information and write down questions periodically on their own. As Coronado et al. States, it becomes essential to estimate the level of information that patients want to achieve and to check back with them once they have had a chance to review it so if they have any outstanding questions can be addressed. 2017. By having a standard tool to reference, nurses and physicians can get better at the uncomfortable topics such as sexual health, end-of-life decisions, and expected outcomes. By going through all the topics of oncology care, patients and families can become content in their team, make the best decisions, and decrease one's anxiety and stress related to their diagnosis. Second, based on what Berger et al. Proved, as the healthcare team implements this standardized educational tool, education should be provided routinely every 3 weeks to increase retention and satisfaction, ultimately creating better understanding. Berger et al. Included 98 patients in their study. The researchers used the QLQ Info 25 questionnaire to assess what each individual knew prior to the sessions, and then repeated it 2 times post-educational sessions. The purpose was to assess if the sessions met all their expectations and if they lacked information in any areas. As a result, after the physicians taught the participants, their knowledge increased 83%. Even though the patients had low pre-scores, they rose from baseline. The student believes that this information was divided and continually taught. Instead of bombarding the patient right after one's diagnosis, they would learn and retain more. By implementing these 2 recommendations, oncology patients will no longer have a knowledge deficit, and their trust and relationship with healthcare will significantly improve. The implementation of the standardized tool would start with a committee of researchers, nurses, and providers. They would need to discuss what information is needed and how to simply word it. Once the committee approves this project, the nurses and providers can collaborate and create a binder with up-to-date information, education compliance, and various treatment options. After the binder is printed and ready to test, a team of trained nurses and providers will implement the tool. The second recommendation can simultaneously be used with the binder. The trained team will write out the educational plan and teach specific aspects during each session. After each of the sessions throughout this trial, a QLQ Info 25 survey is done by all participants, the nurse, patient, and provider, to see if the information flows, answers what the patient wants, and if the handouts are appropriate. After the 6-month trial phase, the nurse and providers will discuss any changes that need to be made to the plan or the binder. The potential issues that this recommendation might face is the cost of the materials, such as paper, the binder, pamphlets, the time spent to create this tool, the collaboration process between the personnel, and the education that these trained personnel might need to get correct results. In conclusion, education is imperative for oncology patients. It is the job of nurses and providers to assess each individual, see what they know, and what they need to know to make better decisions. This assessment decreases any emotional factors and promotes their quality of care. Patient satisfaction, their quality of life, and comfort levels can all be affected positively or negatively by education. Through the creation of a standardized tool and spread information sessions, patients are informed about non-critical information, given resources to help post-cancer treatments, and prioritized in the midst of the bustling hospital. In the end, having planned education sessions during one's treatment can increase retention, decrease communication barriers, cover all aspects of care, and allows for the complete care of a patient's quality of life and emotional status. Here are my resources. Thank you for listening.